Hello, everyone. This is Cameron Corteggiano with Becker's Healthcare. Thank you for joining us for today's webinar, Driving Revenue Cycle Excellence with AI Cameras in Surgical Areas. Before we begin, I'll walk us through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have issues with the audio or visuals, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I'm pleased to introduce today's speakers. First, we have Shlomo Matayahu, CEO and founder of IDENTI Medical, and Lisa Miller, Chief Sales Officer and Revenue Cycle Expert at IDENTI Medical. Thank you, Shlomo and Lisa, for being here today. I will now turn the floor over to Lisa to get us started.
Great. Thank you, Cameron. I'd like to welcome everyone today. We've had a large audience and interest, and it reflects the need in the market. What we're talking about today is still a big challenge and a persistent issue, which is charge capture in surgical areas. And we believe at IDENTI, we have the solution to solve this. Revenue cycle is still challenged by manual capture methods or methods that use older technology. And this causes gaps in charge capture and unfortunately unnecessary financial losses. So today, we're really excited, Shlomo and I, to present you with AI-driven camera technology. And we're going to show you how it transforms data capture at the point of use, which significantly reduces revenue loss. And that shift will have an immediate financial impact for hospitals. And we have a few case studies to show you as well. So let's begin with charge capture and how it impacts different stakeholders, right? So how each of these stakeholders have their roles and responsibilities and challenge, but they all want the same outcome, right? Supply chain, nurses, and finance. It's mission and margin. The mission for exceptional patient care while balancing the margin required to achieve that. So ultimately, the revenue cycle is about being able to capture all the charges to document so that a hospital can achieve full reimbursement. And that's what today's webinar is about. So supply chain sees charge capture, with managing inventory and cost. And there's some challenges with that, with the manual and barcode-based systems to accurately manage that inventory. Nurses see it, right, from the documentation, ensuring quality side, but they have an increased burden from the manual aspect or some of the issues with barcodes, and that those administrative tasks really divert their nursing time from patient care. And of course, finance sees it because it's so important. They want to get full reimbursement and in a timely manner. So, today's purpose is to show you that we can solve all three of these stakeholders, challenges as it relates to charge capture in surgical areas with AI technology. So this is what today's reality looks like, right? It's not anyone's fault. This is the system that we have. We've got paper, we have stickers, we have barcodes. We have some issues with technology, and it's overall it's really challenging, right? So whether that's again, like the manual logs, RFID, it's fragmented and unfortunately it's unreliable, and there's different multiple entry points. So today, what we want to show you is that AI camera technology can achieve and does achieve 100% accuracy at the point of use. So a little bit further about this, right? So these are the 6 common current data capture methods, whether that's barcode scanning or RFID to manual stickers, the point of use, or EHR, EMR. These are the current methods. And, we're going to show you now, which is really exciting, that the new era of revenue capture at the point of use is powered by AI computer vision. So very simply, we're able to capture 100% of data or 100% of implants, high cost implant supplies within seconds at the point of use. And a little bit about why those, the reasons existing methods fail, right? I spoke about it a little before, but barcodes, have a problem that I don't know if it's really spoken about a lot, right? So there's multiple barcodes on a box, on an implant, or sometimes none at all. So what happens if you have to figure out which barcode to use, or there's no barcodes used, and that implant gets put aside and then has to be manually put into the system later. There's missing or partial UDI data. There's discrepancies with scanned items and item master files, and a lot of the a lot of those charging comes post case, and so anything that happens post surgery, and we'll show you in a moment, really is prone to just missed items.
Lisa?
Hello?
Lisa, we couldn't hear you.
Can you hear me now?
Yes, we can hear you now.
We lost you.
This is an example of a hospital with 10 ORs performing about 20 orthopedic cases per day. And so on average, we gave this example that 4 cases misses at least 1 implant, and that 1 implant costs on average $1,200. So that daily loss is $4,800. Over time, that's $1.2 million. Now this example is just one service line in orthopedics, and this is what we see traditionally over hospitals throughout the country. So our philosophy is simple. There's accurate data capture. Upstream has multiple downstream impact. And so what we mean by that is that imagine that you have one point of truth, and then you can control everything downstream. So if we can capture 100% of the data up front, then all the other problems or all the other challenges are solved downstream. And so, this is our philosophy. Accurate upstream data capture directly influences financial outcomes downstream. And we're going to go over 13 charge capture problems impacting your OR that AI camera technology can fix. Number 1, cases waiting for manual corrections. So to me, I've been working in the OR for over 20 years, and I think this is a challenge that I see day to day, constantly. After the procedure, the patient billing sits on an OR biller's desk. It awaits validation for implants and supplies used in the case. And so a couple of things happen. Number 1 is that it's delayed, right? So, how many of these, high cost cases are delayed because they're validating or something's missing? And up to 25% of charges are a loss when entry is delayed more than 72 hours. And I think, and number 2 is not only the delays, it's really the inability to capture all those implants that are used. So with intelligent image data capture, we guarantee same day charging. So think about that. All those items at the point of use in the OR, 100% of that data is captured, and now we have no more need for waiting post-case for days. Sometimes I've seen cases waiting weeks and unfortunately even longer for implants and supplies to be added. Problem number 2 is just missed charges, right? So challenge yourself. Could you run a report on your implant spend over the past year, right? So if you were able to kind of understand that revenue report and then confidently match that to reimbursement, would you have at least a 90-95% accuracy on what you've spent versus what you've invoiced? So a lot of times when I've looked at kind of an analysis of charges, we'll see in a spine surgery, 1 rod and 3 screws. We know that's not possible because you need 2 rods and then an even number of screws. So 72% of respondents identified missed charges as a primary issue in their charge capture process. This is from research. So with intelligent AI camera, we snap it once, it's captured forever, it's completely digitized, regardless of the item type, whether it's consigned, owned stock, bill only, or count sheet. So imagine even a count sheet that you have for screws that are screws and plates that are in the sterile department and put into that sheet that count sheet's put under AI camera technology. We can capture that as well as any of the other boxes and supplies. Problem number 3 is miscellaneous items, right? So this is where you have a placeholder for that item. And miscellaneous items have been going on for a very long time, right? But this creates a problem because a lot of times, not only is it, there's not accurate, the data's not accurate, but the pricing's not accurate, it's duplicate, and then you have to figure out which item to use. So, miscellaneous items is a big problem we see throughout the country as well. With accurate product descriptions combined with AI algorithms, we're able to consolidate into one single source of truth. And that's all done on the front end, right? So there's no back end work. There's no kind of cleanup, item master, charge master cleanup. This is all done on the front end because we do have this, AI computer tech, image to data technology. This is a big problem, and I don't think we talk about it enough, how data capture at the point of use can impact negotiating with managed care payers. They have all the data, and we want hospitals to have that same data, so that accurate data can boost your managed care reimbursement and strengthen like your QBRs or any kind of analysis. So by having full transparency and analytics into every item used, it gives you a clear advantage so that now you can negotiate, really understanding what your spine case is, what your cardio case is, what your true costs are. So when you are negotiating, you have your own data and you're confident in your own data. Aligned with that is carve-out revenue. So a lot of managed care contracts have carve-outs for high-cost implants. And I've seen this in a number of contracts throughout the years where that carve-out revenue is lost because there's no proper documentation, or hospitals have to go back manually and get that documentation. So with our intelligent camera system, all of your high-cost implants are captured at the point of use. We have a reliable audit trail. We have proof for the payers, right? So they can honor their carve-out agreements. And so many times revenue cycles calling down to the surgical area, asking for proof. And our clients, particularly the revenue cycle department, they're very excited that they know they can go into their system, see that digitized PDF high-cost implant, and they can take that down themselves, right? They know with full confidence they've grabbed that that implant at the point of use and send it as proper documentation for those carve-outs. And I think that 1% to 3% loss because of not getting that carve-out payment is really a simple way to ensure or to increase revenue. Number 6 is inaccurate analysis of physician and service line profitability. I think this is a big conversation because we need to align with physicians, and sometimes physicians aren't 100% sure whether the data is accurate. So could you run a report today analyzing service line profitability over the last 6 months? And that's meaning that without having to pull different reports together in order to combine one report and then have that for your physician. So because we have full visibility into cost, we can give this level of insight that supports data-driven discussions around performance, efficiency, and resource use. And this gives the physicians confidence too. Obviously, they see that there's camera technology in the ARC capturing 100% of the data, and they can also be sure when they're given reports that they trust that analysis. And this is another big topic, right? Problem number 7, manual management of bill-only data. So the bill-onlys come in, that's a manual process. We all know that any time there's a manual process, that it creates inefficiencies. So new items come in without being preloaded into the item master, into the system. And that really, creates some problems. Is it owned? Is it consigned? Is it, trunk stock? And, there's a lot of losses around this area of bill management, manual management of bill onlys. And again, as you will see when Shlomo makes the technical part of the presentation, by having a camera technology to capture all the data on an implant or a supply item, this manages even this very challenging area for surgical areas. Problem number 8, it's the item master and the CDM are not synchronized, right? So if you think about it, the item master is a source of truth for what's in the inventory or consigned, and then the CDM there's a crosswalk through to the CDM, and many times that's not synchronized. 30% of hospital item master records contain bad data. That could be pricing, the old data, there's duplicates, outdated descriptions. And this then complicates, this creates a problem when syncing or having that crosswalk to the CDM. And so again, as I said earlier, when we get the 100% of the capture right, and it's done at the point of use, all of these problems are solved downstream. Problem number 9, and this is a compliance issue, but I've seen this so many times, and we see this when we're doing our evaluations and trials, with our camera system, expired items are detected just moments before they're implanted. So it is the final protection for any hospital that by accident may use an expired item. And we've had customers come to us just for this one reason, that they want or they need that requirement to ensure that they're capturing those expired items before the case. So nearly 1 in 4 staff witnesses expired items used on patients, and I think that's a big number. Problem number 10. The new Teams bundle from CMS is coming out in 2026, and there's like 761 hospitals that have to pay attention. They're required to be part of this new Teams bundle, and that some of the service lines are ortho, cardio, and this will give hospitals even further pressure to operate more efficiently and to understand their costs, right? So capturing 100% of those implant costs and supply data is essential really to understand and be able to address the bundle payment models, right? Where you have to save, where you're ensuring you're capturing the data. So real-time analytics, surgical bundle payments really empowers you to pivot, right? Pivot at the moment, and as you see issues, see costs increase, and then you can make those data-driven decisions. Problem number 11 is vendor disputes. And when we talk about vendor disputes, we're really talking about consignments, right? So could you right now capture all of your consignment agreements in one place? And so what we see, particularly as it relates to consignment, is that when you're doing those, or when the vendor or you are doing the true ups, are there times when you can align on what was used, right? And so a lot of times we're also seeing the consignment is mixed with owned inventory, because your consignment may have 3 each of all items, but you've purchased some of those, and so there's a lot of issues around vendor truing up on these consignments. So with AI technology, camera technology, we have a platform that can align the vendors and enable accurate consignment management. And actually, it really works together with vendors, right? We want to work together, so nobody wants to mistakenly overcharge or have any kind of disputes. So we're able to align with the vendors because of our technology. Problem number 10 is joint commission audit. And this one I really love because if you can think about it, every single implant supply item is digitized because of the camera technology. And so anything, whether there's any implant, any kind of the expiration dates, recalls, all of that now is digitized. So if when you have that joint commission audit and that question comes up, you have complete, accurate, digitized records and accountability of all those implants. And to me, this is a big benefit, as well as the others that we've spoken about. And then number 13 is nurse dissatisfaction. And so, we hear very often that the nurses are, there's some frustration, right? We want to remove nurses from the supply chain completely. We want to make it so easy for them to put a supply item, as you could see in the right hand of this side of the screen, that they can put a supply or implant under that camera. It snaps, and every single bit of data is captured from expiration to the manufacturer, lot numbers. 100% of that data is captured, and we have a very, very high satisfaction rate because the nurses aren't searching with the barcode to find the item. They don't have to worry about the stickers. They're not being asked post case, we need help. We've got a couple of items missing. Can you validate it? There's a lot of post-surgery work that goes on with nurses in addition to in the surgery, which distracts them, from really what they're there to do, which is to provide, patient care. This is an example of a neuro room where there were I'll go through just a few of those challenges that were faced. Of course, they were facing patient safety issues, recalled and expired items not properly managed, inventory issues. They had less than 40% of the items captured at the point of use. There was nursing compliance, really, because of just frustration around the barcode scanning and a lot of manual entry, which will just lead to, some of the poor charge capture. And then workflow issues, training issues, and incomplete data. And so KPIs that we identified after using the Snap&Go were 100% of digital charting process, right? Fully automated inventory management, a 31% increase in utilization rate. So we improved our charge capture up to 90%. I think some of the big issues around this case study is that there were no expiring or even close to expiring products in stock. Nurses reduced their time on manual entry, if not completely eliminated it. And before I hand this over to Shlomo, I want to give everybody an offer. We have a special OR revenue assessment that we've created here at IDENTI, and it really focuses on revenue cycle and the charge capture process. So if you connect with you can connect with us at info@identimedical.com. Within 3 days of this webinar, we will provide you with a complimentary OR revenue assessment report. And this really is it's very useful because it'll uncover mischarges, hidden revenue, where your OR performance can improve. And this is strictly around that charge capture, we just reach out to us and we can provide that to you. I'm going to hand this over to Shlomo now.
Thank you, Lisa. So from what we see we understood that one of the challenges in order to improve the downstream processes within the hospital is to make sure that we have 100% data collection at the point of use. It's actually the upstream. And the Snap&Go, which I'm going to present here, is a AI based camera technology, which actually enable 100% data collection in the point of use. And this actually impact everything. I've seen many facilities that when they look at their their challenges they are facing, they are typically have been trying to handle the implication, to deal with the implication, and to find solution for the implication, while solving the data collection at the point of use was the main, let's say, challenge that have been the reason for the implication that they've been dealing with. So the Snap&Go is a technology which is based on image recognition capability, on camera technology, in which the point of use was a crucial element to deploy or to be successful with the technology that have been developed. The idea was to create a situation in which when we would like to collect the data, and typically, obviously, the collection of the data should be at the point of use, which is at the operation room, at the procedure area, and by the nurses, not by other kind of FTEs or people that might go in and report the usage, but the nurse need to do it. And this is actually the contradiction that we needed to solve. For one end, we would like to take the nurse out of the equation or reduce their work and make sure that she is dealing with the patient and the physician. From the other end, this is the right place to collect the data. So the point of use, let's say, element, the Snap&Go camera, was a crucial element to make sure that we will be successful with the entire solution. This is why the Snap&Go provide the nurse an ability to just take a fast or a quick picture of the item that have been used. What we are telling to the nurse, you just need to snap the item and you will continue to do what you are entitled to do, or the other most important element in the process. Now, the email and we need to provide a very fast interaction to the nurse, saying, okay, you are good to continue. So the entire interaction between the nurse and the camera, it's just by getting a green light or a red light, and that's it. She do not need to hassle with elements or items that she cannot read. Where is the barcode? What is the barcode? I cannot read it. The catalog is not there. All of this type of obstacles that reduce the compliance rate of the nurse. So this was the first element, the point of use. As soon as the nurse take the picture, she got a quick, immediate notification. There is the green, which is a green light. Green light says we have a good image. And from now on, all of the image is going up to the IDENTI platform. And in the IDENTI platform, we are activating the AI models and the machine learning, which build up from many different, let's say, elements. Inside, we have data. We are doing the data identification, data validation. We are activating algorithm, which comparing the information that we gather to our, let's say, a lack of data that we have on the cloud. Finally, when we see that all of the information about this specific item is accurate and correct, this information is pushed into the ERP system, into the Epic, to the Cerner, to the Info or PeopleSoft, whatever ERP, EHR, EMR system that the hospital use. The way that we see it, the entire, let's say, concept of the Snap&Go and the IDENTI platform is to provide very accurate, 100% of the information of the items that have been used during the procedure into the hospital EHR, EMR system. And this is basically based on the understanding that this is actually what is needed to this system, to this novel system that the hospital currently have, in order to continue and do the other processes downstream, which is the procurement, the billing, the revenue cycle, inventory management, any other elements which today sometimes is dealt with a lot of difficulties, mainly because of the fact that there is no complete data going into those ERP, EHR, EMR systems. And today, what we found out is that in average, the compliance rate of data collection at the point of use is 48%. And when it's 48%, definitely it's impacting the ability of the hospital, of the procurement, the logistics, every other element, the revenue cycle, to complete and to do the task that is needed at their side. So when you are doing this process, providing the nurse good capability with understanding, okay, I took a good picture, got a green light, everything good, so there is no workload on the nurse. It's take her 1 second, 1 to 2 seconds per item, is negligible time per the time, so she feels very comfortable. The compliance rate is going very high, and then the AI and machine learning and the algorithm on the cloud do the rest. We identify the item, and now this information is pushed to the hospital system, and now the hospital EHR EMR system can continue and do the rest of the operational activity need to be done there. So when we design the solution after understanding the challenges that have been described by Lisa, we realized that in order to get this compliance, this was the basic element. We need to take off a key entry, no more key strike on computer, no more notes, no more labels, no more stickers, nothing like that. There is no barcode anymore. We are not using barcode. We do not need the nurse to educate her what barcode to read from a different manufacturer packages. There is no, the system will alert on the spot in case like a last line of defense, if an item is on recall or expired, you will get this information, and the process that is actually to validate or not to validate, but to see or to tackle situation in which, okay, the catalog is not in the system, this is a bill only items, or this is other different of the procurement structure that the item get into the system, and you need to fix things. Now it will be happen not at the operation room, not by the nurse, but the right people downstream the process by the procurement team, by the logistics, by the revenue cycle. But now they will have full visibility of that. Now the fact that we have this very accurate information, no matter what is the type of product. So if it's a bill only that came with the agent, the trunk stock, you can snap it, and it go to the patient file, and it will go also to the operational file. If it's consignment stock, you can snap it. If it's screw, nuts, and bolts, you can read you can snap the count sheet into the system. If it's custom pack, you can snap the custom pack. So actually, the entire process of data collection it become very simple, and now we can continue to operate. Let's see a short movie of the Snap&Go in action.
Four items prepared. Place them on the area. Wait for the green light. Remove. I don't wait to see if it's being processed, nothing. I just continue. It's just my job. I'm the nurse. I'm here to just scan everything. And done. We'll add it to the screen in the next one. Afterwards. And as you can see, it identifies it as it goes along. You don't need to wait for it to identify to get the next one. And then we can even check them now to make sure that the things were identified correctly. 4 items prepared. Four items prepared. Place them on the area. Wait for the Four items prepared. Place them on the area. Wait. items prepared. Place them on the area, wait for the green light, remove. I don't wait to see if it's been processed, nothing, I just continue. It's just items prepared. Place them on the area, wait for the green light, remove. I don't wait to see if it's been processed, nothing, I just continue. It's just my job, I'm the nurse, I'm here to just scan everything. And done, we'll add it to the screen in the next one. Afterwards. And as you can see, it identifies it as it goes along. You don't need to wait for it to identify to get the next one. And then we can even check them now to make sure that the things were identified correctly. I see here this is the manufacturer Angiodynamics Incorporated, Angiodynamics. We have here the reference number, which is 06597050. That's the catalog number. The description, these are all the information that's now saved on in our database with the description. We have the lot, which was also read through here. As you can see, also the expiration date, 4th of 2023, and over here also 4th of 2023. If I go in here also, I can see all the details. It's a bit compressed here on the screen, but it's more so for back office purposes. I can zoom in, I can see everything, make sure, double check that everything's correct. And you can see the barcodes clearly, just to make sure that everything's also accurate. And that's that. And let's say you need to delete something, you scan something by accident, big X, just click, and that's it, it's gone. And
So as you can see, the process of data collection by using a camera is much more, it's simpler. It's very easy for the nurse. This is why the compliance rate is very high. And when we are collecting the information, we are collecting all of the information. It's including the batch ID, serial number, expiration date, manufacturer, a production date, all of the information relevant from the package directly from the manufacturer label. And this information now, when we are now pushing this information to the EHR and EMR system, now we can manage many aspects of the process, including, from the clinical prospect, we have the patient file now, the batch ID, serial number, expiration date. For the procurement, we have all the information with the catalog number and everything in order to deduct it from the inventory. We can do a lot of activity which is now was unable to do, or what we found a niche or a different location in which the data has been collected for every stakeholder in the process. Right now, if you look at the entire picture, at once, when the nurse snaps the information is go to all of the stakeholder in the process, upstream and downstream, and now they can continue their processes. Now, the way that we deploy typically the system, the technology is inside the operation room. In every room, we have a Snap&Go, which enables the nurse easy access and easy capability to do this, and it fits to any environment, which is actually the operation room or procedure area. We see that these are the main location which the Snap&Go provide a lot of value. Now, so a little bit about IDENTI. The solution that IDENTI provides is part of the Snap&Go. It's part of a line of solution which provide autonomous workflow and complete visibility. And the information that we can provide is partial, can be done with RFID technology. We have the wireless weighted bin. We have the Snap&Go, which is the data collection information as part the point of use. And in total, it's provide both transparency and utilization for the hospital.
Yeah, so I'm going to jump back in and really just let you know you can scan. Go ahead and use the QR code. You can scan for the offer. Again, within 3 days from today, we will provide any hospital with an OR revenue assessment report. And it's customized and it's very informative. And, we hope that many of you take us up on the offer. And I just want to have one final recap. If you think about, where we are with camera technology, so many other places in the hospital are using camera technology, whether in patient care or even now in different other aspects of the hospital. And so what Shlomo and IDENTI Medical has done is pioneered camera technology for use on the business side of healthcare. And so this use is really on the forefront, but it makes so much sense as we use camera technology in so many other aspects in healthcare. So we believe that in the next couple of years, this will be the standard for healthcare, to use camera technology on the business side, using camera technology for revenue cycle to capture 100% of the data, which again is the most critical part of charge capture and a revenue cycle is the data. And once we have 100% of the data, we can do all kinds of things with the data, including, the analysis, getting 100% of the revenue that's deserved for each hospital, and managing inventory and keeping patients safe. So with that, I'm going to turn it over. We've got a number of questions and we'd love to answer some questions.
Awesome. Thank you, Shlomo and Lisa, for that wonderful discussion and presentation. Like Lisa said, we've got some time for the Q&A before the end of the hour. So members of the audience, please feel free to submit your questions via the Q&A box on your screen. And we'll get started with the first question. So the first question is, what is the typical ROI timeframe, and how quickly do hospitals typically begin to see financial gains after implementation?
Yeah, that's a great question, and one we get asked often. So typical ROI is going to, I think, shock everybody, because the camera technology is very cost effective. It's I think when we present to hospitals, they're surprised on the pricing. But typical ROI is a month or less, because of the increase in implants and supplies and the charge capture that happens immediately. Listen, we've had an ROI impact within a week or within 100 cases. So, we've seen just an incredible kind of return on investment for hospitals. Again, the system is very cost effective, and then what we can do in a very short period of time is pretty remarkable. But again, that speaks to the capabilities of having an AI camera technology capturing 100% of charges and implants. Maybe I can answer the second part, the financial gains. Most recently, in for a few of our clients, we've seen financial gains anywhere from, in specific service lines. Again, we'll go back to like CV or orthopedics, but we've seen gains of, like $1.8 million all the way up. So those gains have been quite substantial. I mean, you think about it, again, you go back to that initial example from ortho, just picking up out of 10, 20 cases, just out of 4 cases missing one item. I will tell you that in my analysis over the years, just one spine implant, can be several thousands of dollars. So, the financial implications are quite significant, definitely in the millions of dollars. Okay, next question.
Awesome, thank you. So the next question is, can your solution integrate with any existing EHR, ERP, and billing systems without disrupting current workflows? And how long does it typically take to deploy and integrate your solution?
Yes, so we are, Workday partners. We work with Oracle. We work with Epic. So all of that is seamless. We have global installations. So if you think about that, we've been able to work in, so many different environments, and in so many different EHR systems. But of course, the biggest would be Epic, Oracle, Workday. We are, Workday partners. So that is seamless. Integration can be, as if we have alignment, it can be as quickly as 30 to 60 days, right? It's really simple. I mean, I'll let Shlomo, you might want to answer that in a little more specificity because that's what he handles. But, we have a very easy path to get this implemented. And certainly there's different phased approaches to do that, but it does not disrupt any sort of operations. It's very seamless. And somebody asked about Meditech. Yes, we work with Meditech as well. I see it. I might as well answer that question since it came in, Jennifer.
Great, thank you. The next question in the chat is there an integration to inventory management systems where an item gets scanned and then alerts supply chains of the possible need to reorder?
I'm going to let Shlomo answer that. I think I have the answer to that, but he is the technical visionary expert. So Shlomo, do you want to answer that question?
Yeah, sure. This is exactly the main of the Snap&Go is to collect the data and transfer it to the hospital system, to the Info, PeopleSoft, Oracle, whatever it is, in order to create a reorder. We see the Snap&Go, as I said before, a data collection tool into the hospital ERP system in order to create an order. So an integration is something that we are seeing as essential in order to gain the most value from the Snap&Go. So we typically recommend to connect or to integrate the Snap&Go, the IDENTI platform, which is the cloud server, to the ERP system from one end, or to the operational system from one end, and to the clinical software from the other end. So we will gain also clinical information as well as operational information in order to deploy inventory management, reordering, and many other elements that is needed in this regard.
Yes, so Cole, yes, and I thought the answer was yes, and you got the definitive yes, that will impact supply chain, and then you will get alerts for reordering. So the answer is yes. Thank you for the question.
Great, thank you. The next question is, what adoption rates have you seen across surgical teams, and how do you ensure sustained compliance over time, especially during times of staff turnover and peak workloads?
Yeah, great question. So we have such an incredible adoption rate because, as you saw in the video, it's so easy to use, right? So if you think about it, now a nurse in the OR has to just put the package under the camera. The camera takes a picture and is able to capture all of the information, and that goes right into the system. And so, it's funny because I've spoken to nurses, and I've had nurses say, look, like, who wouldn't love this system, right? I mean, so we have nearly 100% adoption rate. We don't have problems there because the nurses really, they love the system. It's easy to use. And they're free to do with, really what they are going to use. So adoption rate is very high. And then the continual use, why would somebody want to go back to using a barcode when all they have to do is put a package under a camera and it snaps, and then you can continue? I mean, there would be no reason why you'd why you'd want to go back, right? So we don't have an issue with the continual compliance because it really is so easy and integrates easily, and we don't have issues with continual use. I mean, our customers just really love, having that camera technology in the OR.
Yeah, maybe I would like to provide additional point of view to that. When we talk about adoption rate, so we will divide into to adoption rate of the nurse inside the operation room. Here, as said by Lisa, what we see, nurses love this, and it's easy to be used, so they use it easily. The adoption is very high, very high. From the other end, when we look at the operational perspective of the Snap&Go, it's done mainly in the hospital system. It's in the ERP system or the EHR or EMR system. And over here, because now you have a very accurate data into your operational system, you know what has been used. You know you get much more accurate information for billing, for costing, for revenue cycle. The adoption and compliance rate is also, again, very high, because now you got right information, right and accurate and full information in the system, and you do not need to hustle around to collect the data and ask the nurse if you've done it or not, if you use it or not, or all of these type of things, which sometimes create a lot of difficulties.
Great, thank you.
Yep.
So the next question is if there's potential of putting this technology into inpatient rooms in areas where there are high cost and high value items. A lot of focus is obviously on the AR, but there's also value in the inpatient units. Is that something that's possible?
Yes, it's. I don't know currently if we have an installation in the inpatient room. However, we've been talking to many hospitals about that use, and it's. We're obviously also learning from hospitals where they think the value is. But yes, it can be deployed anywhere. It can be deployed in a patient room, and in those patient rooms that have higher costs. Absolutely. I mean, think about the ease of use, right? Of having the camera technology in one of those rooms, and they just snap, and then of course that implant, or not implant, but that high cost supply item would be captured. So 100% yes, it can be used there. And we've had that question before, and we are in talks with those hospitals about that awesome. Use case.
So the next question is related to the demo video where there were a couple items that were still being loaded into the system. Does it eventually find that item, or what is the workflow like if it is unable to locate that item?
Shlomo, do you want to take that? I mean, I can just start taking that question, but it really isn't a matter of locating the item. It's a matter of that no matter if that item is in the system or not. And that's the beauty of having Snap&Go or having the camera technology, is whether or not that item is in your system, we capture everything that's on that box, everything from that manufacturer number, to expiration, lot number, everything's captured, so that if it's not in your system, then post case, we have that digital record, we have all that information, and then post case, we can seamlessly get that added into your system. Shlomo, do you have anything to add to that?
No, I think it was excellent answer.
Okay. And that's the beauty, right? We capture. Think about using your camera, right? You can capture anything you want. So similarly with our patented AI camera technology, we capture everything on a supply or implant box. That information is permanently digitized.
Just to add one thing, imagine yourself that now you have an image of the item that has been used. So from now you can do everything that you would like to do, post-surgery. You do not need to do it during the surgery while the nurse she's under stress with the patient. So and we create a complete workflow to overcome in situation in which the item is not in the item master or it's not in the database. Actually, we have the image. Now we can take care of everything outside of the operation.
Great, thank you. The next question is asking, what is the product scanning recognition percentage, and what happens if a product isn't recognized by the scan, and what is the backup to tracking the product use?
And this is, going back to my previous answer. First of all, we are not scanning, we are snapping. And as long as we have image, now we have the capability to extract the information very easily, So it's not like when you are trying to scan a barcode and the system tell you this item is not in our catalog list, or this item there is no inventory, whatever it is. I cannot extract all of the information, and now you're stuck with the package in your hand, and the system are not going to accept it. The Snap&Go will enable you to snap everything that you have been using, and it will never stop you. Because now when we have the image and we can analyze the image, we can do everything let's say post-surgery or during the surgery, the back end, but not by the nurse, and we are not jeopardizing the operational process. We are not taking time from the nurse during the procedure, post-procedure, to overcome challenges of items that she wasn't able to document. This is exactly the big difference between snapping and scanning. When we are snapping, we take a picture, and as long as the nurse gets a green light, she's done her job, and now we have the image. This can be managed afterwards. Lisa, you want to add something here?
No, I think that's perfect. I think it's we have learned so much that scanning, we're so used to scanning. I think we've got to get used to the fact that taking a picture and that picture is a new technological improvement, right? Because there's so many issues with that barcode and with scanning that the scan and the snap and the technology we have is so different, but it provides the ability to get 100% of data capture within a second. And I think it's just a new advancement in the business side of healthcare.
Awesome. Well, I think we got time for one more question here. So the last question for today is, how does your platform address item level visibility for both owned and consigned inventory?
Shlomo, do you want to take that, or want me to begin that, or?
You can begin, and I will. Yeah.
Okay, perfect. Shlomo's going to give a really great technical answer. I'm sure of it. But again, just as a summary, we have the ability to, once that supply or implant gets snapped, we have the ability right on the it will denote whether it's a consignment or whether it's owned inventory. And again, anybody that reaches out to us, we could also provide a demo. And I didn't mention that earlier. Not only are we offering the revenue assessment, but we can offer a demo to anybody. And I think once you're able to see that with the technology, we're able to denote whether that's a owned item or a consigned item. And Shlomo, do you want to take that a little further?
Yeah, I just want to add one thing. From our principle of operation of the system is that there is no difference between bill only, consign, buy, whatever it is. The most important piece is to get an image of the item. And then when we continue the process, we have the ability to understand if it's buy or consignment according to the hospital ERP system, because over there you maintain this information. But the first let's say, element is to collect the data, to collect the usage. Today, there are so many different processes. If it's bill only, you need to fill in a paper document and stick a label. If it's consignment, you need to take the shipping document and take it to the procurement in order to report the usage and continue reordering the process. And don't forget to send the fax to the vendor, because otherwise you will not have this item for the next operation, etc. So you have many different processes. With the Snap&Go, we have one process for data collection, and then we are doing everything downstream, as said before.
Yes, thank you, Shlomo. Again, we want to thank everybody who joined us for the webinar today. And of course, Shlomo and I are available. You could reach out to us via our email or phone call. We'd love to, talk more and show you our Snap&Go, and of course, take us up on our assessment.
Thank you very much, everybody.
Awesome. Thank you